Thank you for sharing that information as well as that wonderful presentation that you just gave. So now we're going to begin our Q&A session. As I had just stated, I will be asking questions as well as opening up the floor to the public to ask questions as well. We don't take questions directly from chat. Instead, we ask that everyone virtually raise their hand if you're not sure how to do that. In Zoom, on the bottom toward the right, you're going to see a reactions button, and you're going to click on that button, and you'll see the raise hand function that is in the pop-up menu. You'll click on that, and then your hand will be raised, and we will do our best to answer the questions in the order that we receive them. When it's your turn, we will unmute you and prompt you to state your name, where you are from, and ask your question. We will ask that everyone keep their questions brief and on topic. We will then mute you. In order to give everyone a chance to get their question answered, we won't be taking follow-up questions. So let's go ahead and get started. I'll ask the first question here. So a lot of it was heart disease, but what about, with diabetes and all of that kind of stuff, obviously is impacted by a plant-based diet. What should be our ideal blood sugar level, and how do you get it down?
Yeah, no, great question. Great question. Yeah, diabetes, a lot of people think is one of the most, maybe the most, besides cholesterol, important risk factor for heart disease development. 2/3 of diabetics die from heart disease, more than 2 out of 3 actually. So that needs to be the biggest focus. And so eating plant-based for a diabetic is absolutely great. There's a lot of misconceptions. Fasting blood sugar less than 100 is important. Hemoglobin A1C nice and low, at least under 6, preferably lower than that would be even better. Now, I personally don't manage diabetes in my practice, but I do always talk to my patients about plant-based diets. So frequently get into the diabetes discussions because a lot of misconceptions, and they're, oh, what about the carbohydrates? I eat beans, there's carbohydrates, it spikes my blood sugar, you get all these different things. And I say, well, listen, in the short term, eating an apple might spike your blood sugar a little bit because there's sugars, but that's the healthier sugars. It's coupled with fiber. An apple a day keeps the doctor away, right? Beans, good for your heart. So it's still good for diabetics as long as you're doing everything else right. You're keeping it low fat and plant-based and not eating refined carbohydrates or higher fat animal foods while you're at it. And again, what I always think is the most powerful thing to do whenever you're having any nutrition discussion is go to a major medical society's recommendation and tell them their statement. There is a statement from the American Diabetic Association that says if somebody follows a whole food, plant-based, low-fat diet, there is no need to ever count or restrict carbohydrates. You will still lose weight. Blood sugars and hemoglobin A1C will come down significantly. It's in the American Diabetic Association statement right there. Now, it's not the front and center recommendation. They still recommend their whole little eating plan, which does have animal products in it, counting your carbohydrates and doing all these complex things. But they do have a statement about the plant-based, about going on a 100% plant-based diet, which does not require you to count carbohydrates or anything like that. There's no restrictions. Just keep it unprocessed, keep it low fat.
As part of your presentation, thank you for that. As part of your presentation, you mentioned going on Dr. Esselstyn's diet for a little bit. And I know that Dr. Esselstyn can be very strict, specifically with regards to fats. I know that at least for a very long time, he was against, nuts and seeds and that types of things. Where do you stand as far as the people who want to avoid getting sick? He was dealing with a lot of patients who were, had severe heart disease.
Yeah.
People who aren't down that road that far. Is avocado okay? Are nuts and seeds okay?
Yeah, great questions. I get these questions a lot, actually. And so you're right. In his big initial case series that he published and his follow-up series, these were people who already had severe heart disease, right? And so he wanted to do everything possible, the strictest possible to make sure nothing ever raised their LDL cholesterol up and nothing ever damaged their endothelium. And nuts and seeds and avocado, they have some saturated fats. They can bump the LDL up. But what about somebody who's healthy and is just trying to prevent heart disease? They never had a heart attack or a coronary blockage. Really, the magic is in the numbers, right? So look at your LDL cholesterol number. If your LDL is under 70, whatever you're doing is fine. It's really hard to get it under 70 unless you are closer to the Esselstyn diet or closer to the Ornish diet, somewhat restricting the higher fat plant-based foods, but there is individual variability. So you can't just tell everybody's got to do this, everybody's got to do that. you got to know your numbers. And in my practice, I give my patients what we call a standing order to get their lipid profile drawn once a month so that they can change their diet, check it, change their diet, check it, change their diet, check it, and do it over and over again until they figured out all the tweaks that they can do, until they've reached a plateau and they say, this is as far as I can go with diet, then they know. And so are avocados safe for me? Can I eat nuts and seeds? What about little bits of olive oil? Is that safe for me? There's 15% of the fats in olive oil is saturated fats. It will raise your LDL a little bit, right? Well, if your LDL is under 70, whatever you're doing is fine. And your body's tolerating it fine from a cholesterol perspective. But usually to get the LDL under 70, most people have to really restrict the higher fat plant-based foods. So many times it's okay. It's just a matter of you got to know your numbers and restrict it down to the point where you get your LDL under 70. And everybody's different too in regards to their tolerance. Some people be like, hey, my LDL is 90. I'm fine with that. At least it's not 150. At least it's not, 125 like the average American. I'm going to have some nuts and seeds and avocado and keep my LDL 80 or 90. And that's not ideal. But as long as they're not smoking, they're exercising, they're thin, and everything else is fine, there's a good chance they'll be okay.
So if there are plants such as these higher fat plants that they mentioned that maybe should be avoided in certain cases, how about things with regard, going back to the sugar topics, like potatoes, sweet potatoes, squash, or other plants that may contribute to raising blood sugar?
Yeah, so great question again. So what about whole unprocessed plant foods that are lower in fiber, higher in carbohydrates, such as potatoes and such? Well, so a couple things about that. Number one, the problem with potatoes is always the company it keeps. Most people have French fries, or they fry their potatoes, or they put sour cream or butter or cheese all over them, right? So if you're talking only potatoes with no added fat, it is completely fine. There will be a very small subset of people, maybe the brittle diabetics, the people who just really have a ton of insulin resistance genetically, that might have some issues with spiking and such with it. But honestly, if you are overweight and you're trying to lose weight, eating potatoes are very helpful because they're very filling. They have a high satiety index. And if you keep them fat-free, it'll help to keep you full while keeping it low fat and stay physically active. You'll end up losing weight and your insulin resistance will get better despite eating a more carbohydrate-rich food like a potato. And then the other thing to think about, a great example is the Okinawan diet, which was 65% sweet potatoes, no fat added, right? In America, we put butter and marshmallows on our sweet potatoes, not the Okinawans, just sweet potatoes. And 25% was white rice, which we usually don't like. So 90% of their calories were sweet potatoes and white rice, very high carbohydrates, relatively higher, not very high, but relatively higher on the glycemic index. They didn't have diabetes. They were thin. They were physically active. Their diabetes rates were near zero, right? And so it's okay to eat the potatoes if they're fat-free and everything else in your diet is good and also low in fat. That's always the key. I think that was your whole question, right?
Yeah, you got it. I'm just going to ask one more question before I turn it over and ask. I get a question from the audience, which is, you mentioned rice, brown rice, which is preferred over white rice, but now Michael Greger talks about brown rice having arsenic in it.
Yeah, I believe I believe that was my understanding is that's the arsenic. That's the rice that was going to Florida and had to do with I forget, something like the cotton fields that used to be down there, and they used to use arsenic to
as a pesticide.
Yeah, pesticide, right? So it's in the soil. If you get California brown rice, hopefully that won't be the case. And even with rice, it's a little bit more calorie dense. It's not like you should be eating huge amounts. So, I mean, little arsenic, no big deal, right? But you just don't want to have a lot of it. Try to get California rice, keep it organic. So therefore, hopefully, you won't have anything too harmful in it. But heart disease risk, there's not a lot of data on arsenic and heart disease. So at least I could say from my perspective, it shouldn't affect your heart risk. Cancer risk and other issues, yeah, I'm not sure. But my understanding has always been get your brown rice from California farmers, and then that concern isn't really there anymore.
All right, great. So our first audience question is going to come from David. David, please state your name, where you're from, and your question.
Yes, my name is David. I'm from the Washington, D.C. area. And thank you so much for taking my question. I really appreciate this presentation. When it concerns assessing your heart health, my understanding is it's not LDL so much that's important, but either getting the particle size of LDL or oxidized LDL is more important, as well as fibrinogen, homocysteine, LPA, and triglycerides, as well as distinguishing between soft calcified plaque and hard calcified plaque, where the soft calcified plaque is more dangerous, and that's what you should be more concerned about rather than total cholesterol. I'm curious to know what you think.
Yeah, so that's a great question. Currently the way the clinical trials have been set for decades and the way they've been following is LDL cholesterol. And like we spoke in the presentation, the prerequisite of developing plaque has always been focused on LDL cholesterol and another thing called apolipoprotein B. These other markers, these LDL particle sizes, HDL particle sizes, they certainly have been shown that if you have an abnormal profile, smaller particle sizes of LDL, you're more likely to develop atherosclerosis. As of now, though, the reason those types of tests, you may have heard of Berkeley Heart Labs, Boston Heart Labs, Cleveland Heart Labs, they all measure these big complex panels for you. There really is not enough scientific data, clinical trials and research to advocate any specific intervention if your LDL particle sizes are small, or if your lipoprotein (a) is elevated, if these other parameters that you mentioned, fibrinogen, if they're wrong, what do you do about it, right? You're supposed to eat healthy, exercise, plant-based diet, don't smoke, stay thin, control your LDL, control your blood pressure, all those things anyways, right? There is no, if your lipoprotein (a) is a little high, do this, do that. No, there is no specific therapy. They tried niacin. Niacin lowers lipoprotein (a), doesn't prevent heart attacks and strokes. And the thought is it only lowers it by a small amount, not enough to have a significant impact. Plant-based diets, Baxter Montgomery in Texas actually did a little publication on plant-based diets and lipoprotein (a), showing that if you change it, you can drop your lipoprotein (a) by 15%. But many people's numbers are 300 when normal is less than 75. So 15% is not going to get you anywhere near the normal range. And so these complex parameters that we measure, a lot of these other things, the biggest criticism, and it's not in the guidelines, the American Heart Association guidelines for prevention does not necessarily advocate measuring these because there's no change in our treatment plan based on the current clinical trials and evidence that we have, even if your particle sizes are off or your lipoprotein (a) is elevated. Now, there is things coming in the pipeline. Of course, what's it going to be? It's going to be pharmaceuticals, right? But what a lot of people would say is, if you're eating plant-based, exercising, not smoking, staying thin, even if your lipoprotein (a) is high, your fibrinogen is off, your particle sizes are off, you're doing all the right things within your control, and very likely you're going to be fine and not have any issue. In those instances, when you have a higher risk profile based on the Cleveland Heart Labs or Berkeley Heart Labs, make sure you're seeing your doctor, getting things checked out, consider calcium scoring. If you have any symptoms, get on a treadmill, get things checked out. Focus on the prevention, but make sure you're also being very aware of things and getting things checked out closely.
All right. So give me 1 second here. I got to just find, there we go. So our next question is going to go to Mark. Mark, you're going to state your name, where you're from, and ask your question.
Great. Thank you very much. Mark Ferris from Calgary, Alberta, Canada. Great presentation, Dr. Lome. I thoroughly enjoyed your stories. Why, two questions. Why is there so much confusion around diet when you've got proliferations of things like paleo and keto, which, just kind of muddies the water? And then secondly, do you have any other advice for older, I'm turning 60 this year, and any advice on any other supplements or anything that we need to do as we age?
Yeah, great questions. Great questions. First of all, you're not old. You're still a young guy. 60 is still considered young. So, and it's great that you're here and you're going to stay young, hopefully for a very long time, because you're really focusing on the right thing. So the first question being, why is there so much confusion when you hear about paleo diets and you hear about keto diets and all these other things? And again, it's culture and money, right? Our culture in America loves animal-based foods, high-fat foods, and instincts. Our brain loves high-fat foods. So paleo diets and keto diets really appeal to that in our American culture. So people want to hear this. They want to hear good news about their bad habits, that they can eat bacon or they can eat, high-fat animal-based foods because it stimulates their pleasure center in their brain. That's where they were raised. And those diets, the keto and the paleo, they restrict all processed foods. So any diet that restricts all processed foods is going to be healthier than the way most Americans eat. And so when you look at, tons of anecdotal stories, I lost weight on a keto diet and I lost weight on a paleo diet and I feel so much better and all these things. So that's great. Those are anecdotes, right? We're not supposed to use those. What does the science show? What do the clinical trials show? And the clinical trials have very strongly failed to demonstrate that a paleo diet lowers heart disease risk. And just the same with the keto diet. The keto diet studies are very short term. It's not well tolerated. There's lots of side effects. Actually, my next YouTube video I have been working on for a couple of months now is talking about the keto diet, how it's been ranked the lowest, 24 out of 24 by US News and World Report in regards to the heart healthiest diet. They ranked 24 diets. Keto was dead last, 24th out of 24 for heart risk. Cholesterol numbers can go up. It's high fat, high saturated fat. No matter how you end up doing, I eat more plant-based keto, whatever. Well, you know what? Guess what? It hasn't been studied long-term. That's not what the blue zones, the longest living cultures ate. They didn't eat that way, but people love to hear this. They love to hear good news about their bad habits. You can lose weight on it. There was another big recent publication that actually showed that keto significantly increases inflammation markers, which is that's bad because that's one of the big components to heart disease. And so there's a lot of money in it. A lot of doctors will sell supplements. They'll try to get YouTube followers by just spreading good news about your bad habits to most Americans. And people want to hear something that's against the established medical community. So that's why I always advocate only get your information from big major medical societies. There is no medical society that advocates a keto diet or a paleo diet, no cancer organization, no heart organization. And I love to tell the story when people ask about the paleo diet. And I say there was this guy who said he was paleo before paleo was a thing in the 1970s. He followed a paleo diet. He's been very strict on it for decades. And he had a heart attack and a stent put in. And his name is Bernie Sanders. And I actually made a YouTube video with the message to Bernie Sanders a few years ago when that happened. And I said, listen, man, you got to do what Bill Clinton did. Go on a plant-based diet. You're all big into the environment and the Green New Deal that he's working on. Well, you need to be plant-based. You have heart disease. You need to be plant-based for that. He's giving all this funding to the dairy industry and all these things to help bail them out because all these plant-based milks are doing so good and everybody's realizing they're not cows and they shouldn't be drinking cow's milk. And as that realization happens, the dairy industry fails, but they're trying to bail them out. No, come on, Bernie, don't do that. So I sent a pretty nice video. It's only about 3 minutes long. And actually he got to watch it. I actually got contacted by his campaign that he actually saw it. But of course, I don't know if that really changed anything, if he's changed his diet, but hey, making a little bit of an impact. So that's the whole question about the paleo and the keto. Don't do it. It's not recommended. The science doesn't support it. Short-term gains, easier to follow, a lot of misinformation, but long-term, not good for your heart health, and definitely not good. So the second thing you asked was about supplements and things. And honestly, there's two that are very clear, and then there's a couple that are a little bit murky in regards to the science. We always got to be very science-based and evidence-based. And the clear thing was the vitamin B12 we spoke about. Everybody over the age of 50 should take it. If you're on a 100% plant-based diet under the age of 50, you should also take it as well. That's important. The other thing is vitamin D, but only if your vitamin D level is low on a blood test. So it should be part of the routine blood work that you get every year or whatever. Check your vitamin D. Now, other people talk about, what about vitamin K2? What about, should we do iodine? How about omega-3s? And honestly, the science on those is very weak. It's not very strong. We really want in our medical world randomized controlled trials, taking thousands of people, trying this, and then trying placebo, which is fake, waiting and seeing who has heart attacks, who has strokes, what happens to them. Is there a risk to doing this therapy? And there really isn't enough real strong scientific data to make strong, good, firm recommendations for any other supplements. So we're doing our best guesses when it comes to some of these other things. And that's why you'll hear conflicting opinions about, should we all be taking, if you're on a 100% plant-based diet, should we be taking omega-3s? Or is flax seeds and chia seeds and hemp seeds, are those enough? Or those are short chain, but can we convert enough to long chain? There's all these questions, and you'll see the back and forths between different plant-based doctors. Some recommend it, some don't. And honestly, the reason it's confusing is because there's no great answer. And so I just kind of say, if you wanted to and you don't mind, I don't think it's going to be harmful to take an algae-based omega-3 supplement. It's not the end of the world to, take something that has iodine in it and K2. You can overdose on K2, but just keep it low and have it every once in a while. And it's not going to be harmful if a person wants to, if they're okay with supplements. But, I got a lot of patients like, dude, I don't want to take extra pills and supplements. No way. If I can avoid it, then I don't want to take it. And that's fine. Then don't worry about it. And there's no great way to monitor. You could do omega profiles to see how your omega-3 fatty acids are. So those could be done. So people are really concerned and want to check. I do those sometimes. We don't really routinely check iodine levels, but we do monitor thyroid function. And the vitamin K2, there's really no good monitoring for that, honestly. So it's really just B12, vitamin D if your levels are low. And if you wanted to take it as far as algae-based omega-3s, iodine, and K2, you could, but I don't push it on everybody.